So I've heard that one too. So all of these are great questions because I think these are things that come up time and time again. And the way I usually respond to people who say that is the game is completely different now with the variants that are circulating currently. So whereas much earlier in the pandemic, we might have felt a little bit reassured that people who have had COVID-19 infection are unlikely to get infected again, at least for 3 months after their initial infection. What we're finding now is that this idea of immunity after a natural infection is really threatened by the presence of these circulating variants to the virus, particularly the Delta variant, which originated in India and caused absolute destruction and extreme death there, and has now become the predominant circulating variant in the United States and has caused many hotspots of really overwhelming hospitalizations and actually even increasing deaths, particularly in young people in the US. So because one person has had COVID-19 infection earlier in the pandemic does not mean, unfortunately, that they are immune to new variants, particularly the Delta variant. We are even seeing increased rates of COVID-19 infection in vaccinated persons with the Delta variant, but the one good thing for them is that they still are not demonstrating increased rates of hospitalization or death. Infection is still either asymptomatic, no symptoms, or mild in people who have been vaccinated. That is not what we're seeing, unfortunately, for people who get sick with this Delta variant in the United States. Previous immunity, unfortunately, is not any reassurance for variants that are circulating right now. And the more people that remain unvaccinated in the United States, the more people who serve as vectors for transmitting infection to other people who are at risk for getting infected, people who are unvaccinated, people who might have medical conditions that make vaccination less effective for them, such as immune compromising conditions. And the more people who can get infected, the more people who can serve as hosts to allow other variants to develop. And these variants in the future may make our vaccines actually less effective at preventing severe illness and death.